Lower limbs against hard surfaces, there's a good chance you could hurt your knee. So we're going to talk in today's video a little bit about how to evaluate your knee issues and what kind of health professionals to see, and some things you could do from Oriental medicine that could help that I've used in my 30 years of practice as a chiropractor. First, if you fall down, jump off something, hear a loud crack or a rip or a tear, and your knee gets hot and red and swollen, this is not the video for you. Get yourself to a medical doctor, emergency room situation. You're going to need some images, an MRI, most likely. So sometimes they'll do a contrast study if necessary. But you need to see what's going on in there. For minor knee injuries, like overuse injuries, you might get some slight swelling on either side of the kneecap underneath and pain on weight bearing. These are things that you could deal with yourself. If your knee swells up a little bit more, let's say you did a long hike or a run. I first injured my knee hyperextending it, kicking the heavy bag in karate. As I kicked, my knee went backwards, and that force made my knee swell up. Well, being young, 16, 15, 17, whenever it was, I just kept working out on it. It got worse and worse and worse till I could barely use my leg. So that kind of swelling, the first thing you should do is ice it. Bring some swelling down. Rest it. Okay? Elevate it and compress it or massage it. That's called the Rice Rule. And in my book, that you can see the link below this video, if you look at your health in a new way, I talk about a lot more detail about the various methods you could use for an acute injury versus a chronic injury. But there's something that's not in the book, and that's what I want to show you today, are points that you could press on to help this. So first, okay, you haven't hurt yourself bad enough that you need to go to an emergency room. Your knee hurts maybe every time you run or when you get done running. I'm assuming you stretch. My website is howtostretch.com, so I'm just assuming that you stretch all the time, please. And if you don't, this is a good, if you did hurt yourself, one of the recovery videos, which will be after this, will be the specific stretches and strengthening for the knees. But without further ado, should your knee hurt, one of the first things you can do is take your hands on either side and roll the knee. Okay, so what I'm really doing is I'm just trying to move some tissue around. Okay. Studies have shown that within a couple of hours after an injury, you can get adhesions which start to form, which could lead to scar tissue. We don't want that to occur, so we roll it out. Okay, next, okay, roughly 4 fingers below what's called the base of the knee, okay? If you rub your finger along the shin, you'll feel a dent there. That's an acupuncture point or a leg release point in Chinese medicine. Dig in there with your thumb. It will hurt. I can tell you that. My first experience with this, when I first hurt my knee, I was 16. I went to see my teacher. He was a master of acupuncture. He wrote the test that acupuncturists would take to get their licenses here in the United States. So we're talking about a high-level practitioner. So I figured, I hurt my knee, I'll go see the master. I'll see Dr. Sohn. He'll put a few needles in me. I'll be ready to work out the next day. Well, I was disappointed because when I went to go see him, he refused to treat me. But he said, I will show you where to press, where you could fix yourself. So that's what I'm showing you today. It took me, after he showed me this, it took me about 3 to 4 weeks to get my knee functional again. And he kept up with me. And it really, it laid the seeds in my mind to become a holistic healthcare provider. And he's the one who suggested I become a chiropractor. There's another video on that on the channel here as well. But that's not the topic for today. So first find this point. It will hurt. And you rub it 45 seconds. You could hold it. And when you release it, you're going to leave a dent there. Okay? It shouldn't hurt at all. So if you did hurt your knee and you press it, it might be very tender. You could circle it 45 seconds to a minute. Okay? Just press right there and then release. Okay? That's something you could do 2 to 3 times a day. Okay, next, take your 2 middle fingers and in between the tendons of either side of your hamstring muscles, which attach right here, right in the knee there, dig up behind the knee. And this helps to release tension in the knee. And you hold that. Again, you don't have to rotate this one. Just hold it. Mine feels fine now. I don't have a knee injury. But when I first hurt my knee, boy, did this hurt. So you dig up in there. And you release. Now, lastly, for these points, between the big toe and the second to big toe, if you run your fingers up, the bones come together, and you'll find a spot there, roughly about 1.5 inches, 2 inches away from the web where your toe is. and there'll be a bony protuberance there. Right below that, you press with your thumb. Again, you could hold it, you could press. This will hurt a lot. You'll feel like you have a railroad tie slammed between the bones there. Again, with no injuries, these won't hurt. And I'm going to get back to that idea in a minute. So you rub that 45 seconds, a minute, hold, okay, breathe, okay, and then you go back and you rub this way. So let's say you just hurt yourself, your knee swelled up a little bit, you put a little ice on it, it's aching, you're worried about the function in your knee, clearly you didn't break anything, you don't need to go to an emergency room. These are the things that you could do. So press, the measurement is 4 fingers from the base of the knee, and in Chinese medicine a finger is called a kun. Okay, so it's 4 kun from the base of the knee, where you could rub down this way and find that little sulcus. Everybody has that dent in the bone, and it's a culmination of points. So if you dig on it, it's going to be tender if you've injured yourself. Then behind the knee and here, and then rub. Okay, you could do that 3-4 times a day. It took me 3-4 times a day of doing it just like I described for about 3 to 4 weeks the first time I injured my knee, and then it was fine. Okay, my legs are strong, so I didn't have to do any rehab work, but we're going to show you that in the upcoming weeks about how to rehab. This is a short, this is what I do to my patients, by the way. This is how I deal with beginning knee issues, and a lot of times it's just a matter of bringing down some of the inflammation, getting some of the energy to flow through there, and that'll help it feel better. There's ways to set the knee. A lot of times what can happen is that the lower leg, the tibia, can misalign relative to the femur, okay, and the kneecap doesn't track right. And there's a simple home adjustment. Again, we're going to cover that in a different video. Today's just about emergency care to get this all feeling better. So you may not be able to do some of that deeper work, whether it's stretch it, whether it's strengthen it, whether it's to realign it, until you get some of the pain away. So today is how to fix your knee, get out of pain, part 1. Those are the points. Again, there's no harm. Again, I go over this in the book. It might behoove you to see an acupuncturist and have needles put in. I can guarantee you that if you made an appointment with somebody, they'd probably treat you. Wouldn't have the same experience where I wasn't treated by my teacher, but my teacher was my master, and he was here to show me things. Okay, so he used this as an opportunity to teach his student something very valuable. But like I said, that was a rare occurrence. And he didn't charge me, by the way, in case anybody asked. This was an experience for personal growth. So I pass that on to you. If you have any questions, feel free to ask them. Also, if you're sending your questions via the Google, I'm having trouble answering them, so I'm not ignoring them. Try and post them on YouTube, not Google. For some reason, when I type in an answer, it disappears. Okay, and I've tried different browsers. All right, again, thanks for coming by, and speak to you soon.